Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, in this video we can see another set of questions for exam preparation. We will see the question one by one. The first question, most common site of carcinoma pancreas is, and the options are option A head, option B body, option C tail and option D none of this. This is the question and option. Here the question is, which is the most common site of pancreatic cancer? And the answer is option A, head. Head is the most common site of carcinoma of the pancreas. We will see the rationales, that is about 60 to 80% of pancreatic tumors occurs in the head of the pancreas, that is 60 to 80% of the pancreatic tumors, and the tumor may be developed in the head, body or tail of the pancreas, but most commonly the tumors occurs in the head of the pancreas. And the classical symptoms of pancreatic tumor we can see, that is pain, jaundice or both pain and jaundice, and weight loss. Along with this symptom, weight loss is the classical sign of pancreatic tumors. And the other symptoms include a rapid, profound and progressive weight loss and vague abdomen, a vague upper or mid abdominal pain and discomfort may be occurs in the patient. And usually the pain is severe at night and supine position, lying in supine position. So here pain is severe at night and the patient is lying supine position. He may experience severe pain, and the pain may be relieved by sitting up and leaning forward. Okay, so the pain is relieved by sitting up and leaning forward. Here our question is, which is the most common site of carcinoma of the pancreas? That is our question. So answer is head of the pancreas is the most common site. Okay, option A is correct answer. And we'll see the next question. Second question, which of the following is an autoimmune disease? Options are SLE, option B rheumatoid arthritis, option C syphilis, option D sclerosis. So here our question is, which one of the following is not an autoimmune disorder? Here correct answer is option C, syphilis is the correct answer. Syphilis, which is a sexually transmitted disease caused by Treponema pallidum. Remaining systemic lupus erythematosus, rheumatoid arthritis and sclerosis. These three are an example of autoimmune disorder. Okay, option C, syphilis is the correct answer over here. Third question, what advice should a nurse give to a patient on lithium therapy? Question and options are option A, drinks lot of water, option B, take medicine after meals, option C, take medicine on empty stomach, option D, take high calorie diet. Here question is, as a nurse, what advice we should give to a patient on lithium therapy? That is the question. So here the correct answer is option A, that is drink lot of water during the time of lithium therapy. Why? To prevent toxicity. That is, there is a chance of toxicity while taking lithium. So to prevent toxicity, they have to drink lot of water. Okay. Another one important point, there is a hyponatremia will occur in a patient with lithium therapy. That is, hyponatremia means decreased sodium content in the body. Hyponatremia will occur in a patient with lithium therapy. This is one of the important point, that is hyponatremia in lithium therapy. Okay, and this lithium, the normal therapeutic blood lithium level is 0.6 to 1.2 milliequivalent per liter. This is also important point. And prophylactic blood lithium level is 0.6 to 1 milliequivalent per liter, and the toxic level of blood lithium level is more than 2 milliequivalent per liter. This point also very important. Okay, here as a nurse we should give advice regarding drink, that is water. Drink lot of water during the time of lithium to prevent lithium toxicity. Here option A is the correct answer. Fourth question, failure to pass meconium within first 24 hours after birth is called. Question, and options are option A intussusception, option B Herpes disease, option C achalasia, option D none of these. Here the question is, a newborn baby is not able to pass meconium within first 24 hours of birth, after birth is called option B Herpes disease. Herpes disease is a congenital anomaly and is also known as congenital aganglionosis or a congenital aganglionic megacolon. Okay, congenital aganglionic megacolon or congenital aganglionosis, that is called a Herpes disease. This is characterized by absence of ganglionic cells in the distal colon resulting from functional obstruction, that is Herpes disease. And the main manifestations of this Herpes disease include failure to pass meconium within first 48 hours of life and failure to thrive, poor feeding, gross abdominal distension. These are some clinical manifestations of this Herpes disease. Achalasia, option C. Achalasia means is one of the esophageal mobility disorder characterized by absence of esophageal peristalsis. And intussusception, option A. Intussusception is the telescoping of one portion of the bowel into another portion, that is called intussusception. Okay, here our answer is option B Herpes disease. Fifth question, the endotracheal tube should be inserted below the vocal cord up to how much centimeter? Okay, and the options are option A 1 to 2 centimeter, option B 2 to 2.5 centimeter, option C 3 to 4 centimeter, and option D 4 to 6 centimeter. Here our question is, the endotracheal tube should be inserted below the vocal cord up to how much centimeter? And the correct answer is, it should be inserted below the vocal cord up to 2 to 2.5 centimeter. Okay, that is option B is correct answer, 2 to 2.5 centimeter. Sixth question, what is the normal renal threshold value of glucose? This is an important previous question. So options are option A 188 milligram per deciliter, option B 182 milligram per deciliter, option C 170 milligram per deciliter, and option D 180 milligram per deciliter. Here the normal renal threshold value of glucose is option D 180 milligram per deciliter. Okay, that is the correct answer. 180 milligram per deciliter is the normal renal threshold value of glucose. Seventh question, most common clinical features of pleurisy is, and the options are option A sharp stabbing pain when breathing, and option B productive cough, option C cyanotic nail bites, option D tachycardia. Here our question is, which is the most common among this, which is the most common clinical features of pleurisy? That is the question, and the option is correct answer. Option A sharp stabbing pain when breathing is the correct answer. So here we will see what is pleurisy. Pleurisy is the inflammation of both layers of pleura, that is parietal and visceral layers of pleura is called pleurisy. Okay, here pain will be, the nature of pain will be sharp stabbing pain when breathing, and the pain will be worsened, that is the pain will be most severe during the time of taking deep breath or coughing or sneezing. Okay, that is one of the characteristics, most common characteristic features of this pleurisy. Pain will be sharp stabbing pain when breathing, and it worsen during the time of deep breath or taking deep breath, coughing and sneezing. Okay, option A is correct answer. And next question, eighth question, maximum amount of drug can be given through IM route is option A 5 ml, option B 20 ml, option C 15 ml, option D 10 ml. This is very easy question. So by IM injection, how much amount of drug we can give at a time, that is the question. So here the maximum 5 ml of drug can be administered at a time through IM route or intramuscular route. Okay, so at a time through IM we can administer maximum 5 ml at a time. Okay, if we want to give large dose of medication, we have to use IV line. Okay, here maximum amount of drug can be given through IM route is 5 ml. Ninth question, the antidote of morphine overdose is. Options are option A N-acetylcysteine, option B naloxone, option C atropine sulfate, option D esmolol. Here our question is, what is the antidote of morphine overdose? This is the question. Antidotes and all very important area. Here our question is morphine overdose. Antidote of morphine overdose is naloxone, and N-acetylcysteine is there. That is the antidote of paracetamol poisoning, and atropine sulfate is there. Atropine sulfate is the antidote of organophosphorus poisoning. Okay, yeah, our question is antidote of morphine overdose is naloxone. Option B is the correct answer. 10th question, which penicillin is effective both orally and parenterally? And options are option A amoxicillin, option B cloxacillin, option C ampicillin, option D ofloxacin. And our question is, which type of penicillin is effective while giving both orally and parenterally? That is the question. Here answer is amoxicillin is the correct answer. Amoxicillin is effective orally and parenterally. While giving ampicillin to the patient, there is a chance of diarrhea more frequently in case of oral ampicillin. Okay, and cloxacillin is effective only when giving parenterally. And ofloxacin is there. Ofloxacin is not a penicillin group of drug. It is an antimicrobial agent. This ofloxacin is a second generation fluoroquinolone. Second generation fluoroquinolone. Ofloxacin is an example of second generation fluoroquinolone. Our question is, penicillin, which penicillin is effective both orally and parenterally? Option A amoxicillin is correct answer.